About 18 months ago, my husband came across something that most men his age have never heard of. He didn't tell me what he was doing at first. He just quietly started. He woke up a little earlier, he made some changes to what he was eating, he spent time doing something in the bedroom that, at the time, I didn't fully understand. And he didn't offer much explanation, so I didn't push. And then, about 3 months later, I noticed. Not just physically, although yes, physically something had genuinely changed. But what I noticed first was something else entirely. The way he stood, the way he walked into a room, the way he looked at me, with a steadiness and a quiet confidence that I honestly hadn't seen in years. My husband got something back that he didn't even realize he had lost, and this video is about exactly what he did. My name is Dr. Julia Rhodes. I am a certified men's sex therapist with over a decade of clinical experience working exclusively with male sexual health. And yes, I am also a wife. The husband I just described is real. The journey he went through is real, and the results, both physical and psychological, are real. I share that personal story not to make this video about me, but because I know something about how men receive information. When it comes from a clinician alone, it can feel abstract, distant, like something that applies to other men, not to them. But when it comes from a wife, from someone who watched it happen from the inside, it lands differently. So today I am going to speak to you in both voices, as a wife who watched her husband quietly transform, and as a clinician who can explain precisely, research-backed, and honestly exactly why what he did worked. Because every man over 60 deserves both, the story and the science. Before we go any further, if you are a man over 60 or you are a partner who loves one, and you want honest, research-backed, clinically grounded conversations about men's sexual health, please subscribe to this channel right now. What I share here is not available in most doctors' offices. It is not in the mainstream conversation about men's health. It is the information that men in this stage of life deserve and almost never get. Subscribe, and let's get into it. What nobody tells men about what happens after 60. I want to start with something that I believe every man over 60 deserves to hear clearly and without apology. What has been happening to your body? The changes you may have noticed, the things you may have quietly measured and quietly mourned, is not simply the inevitable consequence of age. It is not just something you have to accept, and it is most certainly not something you should be ashamed of. It is something that is happening to the majority of men in your age group, and it is something that, in many cases, can be significantly addressed. Let me give you the clinical picture first. Research documents that the average man loses measurable penile size between his 30s and his 60s. We are talking about between 1 and 1.5 centimeters of functional length, sometimes more. This loss happens gradually, quietly, without announcement. And because nobody is measuring, most men only become aware of it when the cumulative effect becomes impossible to ignore. Some men notice it during erections that no longer feel as full or as firm as they once did. Some notice it in the mirror. Some notice it in the quiet erosion of a confidence they once took for granted. And almost none of them are ever told, by a doctor, by a partner, by anyone, that this loss has specific identifiable causes, and that many of those causes are modifiable. I want to say that again because it matters enormously. The size reduction most men experience after 60 is not purely genetic destiny. It is not simply time doing what time does. It is driven, in large part, by specific physiological mechanisms that respond to specific interventions. My husband David was 63 when he first began to genuinely reckon with this. He had never been a man who talked about these things. He was private, practical, and, like most men of his generation, had absorbed the cultural message that certain concerns were simply not discussed. You noticed them, you quietly adjusted, you moved on. But something shifted for him. He told me later that it wasn't one moment, it was an accumulation, a growing awareness that something had changed, not just physically, but in how he felt about himself, in the bedroom and outside of it, and that the two were more connected than he had ever allowed himself to acknowledge. So he started looking for answers. And what he found, what I am going to walk you through today, is a body of clinical knowledge that exists, that is research-backed, and that most men his age have. Absolutely no idea is available to them. The hidden inches, what science says is actually possible. The first thing David discovered, and the thing that stopped him cold when he read it, is something I call the hidden inches phenomenon. And I want to be precise with you about what this means, because this is not about miraculous growth. This is not about pills or pumps that promise the impossible. This is about anatomy, about physiology, about understanding what is actually happening to the male body after 60, and what can genuinely be recovered. Let me explain the first mechanism. Every man has what is called a suprapubic fat pad. It is a deposit of adipose tissue, body fat, located directly above the base of the penile shaft, at the junction between the abdomen and the genitals. And here is the anatomical reality that most men have never been told. The base of the penis is partially buried beneath this fat pad. The penis does not begin where it appears to begin. A portion of the shaft. In many men, a significant portion sits beneath the surface, obscured by suprapubic fat that has accumulated over years and decades. Research consistently shows that for every approximately 30 to 35 pounds of body fat lost, particularly in the abdominal and suprapubic region, men recover approximately 1 inch of previously buried penile length. The penis has not grown, but functional, visible, accessible length has been genuinely restored. Length that was always there, simply hidden. For David, this was the first moment of real hope, not because he needed to lose dramatic amounts of weight, but because he understood, for the first time, that what he had experienced as loss was not permanent, that it had a physical explanation, and that the explanation pointed directly toward a solution. The second mechanism is vascular, and it is equally significant. The penis becomes erect through the engorgement of two cylindrical structures called the corpora cavernosa. These chambers fill with blood during arousal, expanding the penile tissue to its full erectile capacity. When vascular health is optimal, when blood flow is strong, when arterial walls are elastic, when circulation is efficient, these chambers fill completely. The erection is full, firm, at maximum functional size. But here's what happens over time in the absence of deliberate vascular maintenance. Arterial elasticity declines. Blood flow to the penile tissue reduces. The corpora cavernosa no longer fill to their full capacity during erection. And the result? Measurable, consistent, documented in urology research, is that erections become functionally smaller. Not because the tissue itself has disappeared, but because it is no longer receiving the blood supply it needs to fully expand. Improving cardiovascular health through exercise, nutrition, and targeted lifestyle intervention restores that blood flow. The chambers fill more completely. The erection is fuller, firmer, and measurably larger than it was in the period of vascular decline. This is not speculation. This is the basic physiology of male erectile function, and it is one of the most underutilized levers available to men over 60 who want to reclaim what they have lost. David started with these two mechanisms: targeted weight reduction, focused specifically on the abdominal and suprapubic region, and a systematic approach to cardiovascular health that I helped him build around his specific baseline. Within 12 weeks, the difference was visible to both of us. The pelvic floor secret, the research most men have never heard. This is the section that surprises men most when I share it in clinical settings, because pelvic floor health is almost universally understood, when it is understood at all, as a women's issue. Something discussed in postnatal care, something for physiotherapy waiting, rooms with soft lighting and pastel brochures. Not something for men over 60 who want to reclaim their sexual performance. But the research tells a completely different story. A landmark study published in BJU International, one of the world's leading urology journals, investigated the effect of pelvic floor rehabilitation on erectile function in men with erectile dysfunction. The results were remarkable. 40% of the men in the study who completed a structured pelvic floor exercise program regained completely normal erectile function. 40%. Without medication, without surgery, without any intervention other than targeted muscle rehabilitation. Let me explain why. Because the mechanism is both simple and profound. Two muscles sit at the base of the penis, the ischiocavernosus and the bulbocavernosus. These are not peripheral muscles. They are directly functionally involved in the quality of male erection. During arousal, these muscles contract to compress the deep penile veins, the vessels responsible for allowing blood to drain back out of the erectile chambers. When these muscles contract powerfully, drainage is restricted. Blood stays in the corpora cavernosa longer. Intracavernosal pressure, the internal pressure of the erection, rises and is maintained. The result is a firmer erection, a fuller erection, an erection that achieves and sustains closer to maximum functional size. Now here's the problem. Like every muscle in the body, the ischiocavernosus and bulbocavernosus atrophy with age and disuse. Men who have never been told these muscles exist, let alone that they require deliberate exercise to maintain their function, experience a gradual decline in pelvic floor strength that directly correlates with a decline in erectile quality. Firmer erections are, functionally, larger erections, and stronger pelvic floor muscles produce firmer erections. The connection is direct, documented, and entirely actionable. David added a structured pelvic floor program to his routine at week 3 of his journey. He was skeptical at first, as most men are, but he was committed, and the results, combined with the vascular and weight interventions he had already begun, accelerated noticeably from that point forward. The specific exercises involved are a targeted form of what are commonly called Kegel exercises, though the male version is distinct in its technique and its application. A qualified pelvic floor physiotherapist can provide a personalized program, and I will be covering the specific technique in a dedicated video on this channel very soon. Testosterone, tissue health, and what is actually shrinking. I want to address something that most men over 60 have at least some awareness of, but almost never hear discussed in this specific context: testosterone. Most men in this age group know that testosterone declines naturally with age. They know it affects energy, libido, mood, motivation. Many have had their levels checked. Some have explored replacement options, and many have been told, correctly, that declining testosterone is a normal part of male aging. What they are almost never told is the direct structural role that testosterone plays in penile tissue health. Testosterone receptors are present throughout the smooth muscle tissue of the penis, specifically within the corpora cavernosa. These receptors respond to testosterone by maintaining the health, elasticity, and functional integrity of the smooth muscle tissue that makes erectile function possible. When testosterone is at optimal levels, this tissue is maintained. When testosterone declines significantly and remains low for extended periods, as it does in many men over 60, the smooth muscle tissue of the penis begins to atrophy. This is not a subtle process. Research documents that. Testosterone deficiency leads to measurable changes in the structural composition of penile tissue, a reduction in smooth muscle content, and an increase in connective tissue and collagen. In practical terms, this means the erectile chambers become less able to expand fully during arousal. The erection is less complete, less firm, and measurably smaller than it would be with optimal tissue health. This is a direct, physiological, documented mechanism of penile size reduction in aging men, and it is one that most urologists, let alone general practitioners, never discuss in the consultation room. The good news, and there is significant good news here, is that testosterone optimization through natural lifestyle interventions has been shown to partially reverse smooth muscle atrophy and restore erectile tissue quality. The interventions with the strongest evidence base are not exotic or complicated. Resistance training, specifically compound movements like squats and deadlifts, produces reliable short and medium-term increases in endogenous testosterone production. Sleep optimization is equally significant. Research consistently shows that testosterone production occurs primarily during deep sleep, and that men sleeping less than 6 hours per night have measurably lower testosterone levels than those sleeping 7 to 9 hours. Nutritional factors matter too. Zinc and vitamin D have both demonstrated clinically meaningful relationships with testosterone production. Chronic stress, through its elevation of cortisol, which directly suppresses testosterone, is one of the most underappreciated contributors to low T in men over 60. David's approach to testosterone optimization was entirely natural. No replacement therapy, no medication. He restructured his sleep. He introduced resistance training 3 times per week. He addressed his nutrition with specific attention to the micronutrients most directly linked to testosterone production. His levels, when we tested them 4 months into his program, had risen meaningfully within the normal, healthy range. But more importantly than the numbers, his tissue health improved. His erections became fuller, more sustained, more complete. The tissue that had quietly atrophied over years of suboptimal testosterone began, slowly, measurably, to restore itself. Penile rehabilitation, the clinical field that changes everything. I want to introduce you to something that exists as a legitimate, documented clinical discipline, and that the vast majority of men over 60 have never heard of. Penile rehabilitation. This is not a fringe concept. It is not alternative medicine. Penile rehabilitation is practiced in major urology departments around the world, most commonly following prostate surgery or treatment for erectile dysfunction. And its principles are grounded in the same tissue health science I have been describing throughout this video. The core principle is straightforward. Penile tissue, like all tissue in the body, requires regular oxygenation and stimulation to maintain its health and structural integrity. When erections occur, full, firm erections, the corpora cavernosa are flooded with oxygenated blood. This oxygenation is not just about arousal, it is about tissue maintenance. It prevents the fibrosis and smooth muscle atrophy that cause measurable, permanent shrinkage over time. In men who are experiencing reduced erectile function, fewer spontaneous erections, less complete arousal, arousal, reduced firmness, this oxygenation cycle is compromised. The tissue is not receiving the regular supply of oxygenated blood it needs, and in the absence of that supply, the gradual process of atrophy and fibrosis accelerates. Penile rehabilitation intervenes in that process. The most clinically validated tool in penile rehabilitation for men who are not surgical candidates is the vacuum erection device, commonly called a penis pump, though that term does the clinical reality a disservice. When used not for immediate sexual performance, but as a regular tissue health intervention, typically for 10 to 15 minutes daily, vacuum erection devices have been shown in multiple studies to maintain and restore penile smooth muscle health, prevent fibrotic changes, and support the recovery of erectile function over time. This is not about using a device in the moment of intimacy. This is about a daily tissue maintenance practice, as routine and as purposeful as any other aspect of physical health maintenance. The second component of penile rehabilitation that deserves mention is the role of regular, intentional arousal, with or without a partner, in maintaining erectile tissue health. The clinical guidance in this area is clear. Use it or lose it is not merely a cultural aphorism. It is a physiological reality. Regular erectile activity maintains the oxygenation cycle, prevents fibrotic changes, and supports long-term penile tissue integrity. For men in relationships, this is an invitation to prioritize intimacy, not merely as a pleasurable activity, but as a legitimate health practice. For men without partners, the clinical guidance is equally clear and equally free of judgment. David incorporated a daily rehabilitation protocol into his morning routine. 15 minutes, consistent, without exception. He was methodical about it in the same way he was methodical about everything else he committed to during this period. And that consistency, across all 5 pillars of his approach, is what produced results that neither of us had genuinely allowed ourselves to expect. The confidence transformation, why the psychology matters as much as the physics. I said at the beginning of this video that what I noticed first was not the physical change. It was the way he carried himself. And I want to spend some time on that because in my clinical experience, the psychological dimension of this journey is not secondary to the physical one. It is inseparable from it. And the research supports this with a clarity that I find both compelling and deeply moving. Studies in sexual psychology consistently identify penile self-perception, a man's subjective sense of his own size and adequacy, as one of the most powerful predictors of sexual confidence, performance, and overall relationship satisfaction. Not objective measurement, perception. What this means in practice is significant. Men who perceive themselves as inadequate, regardless of their actual measurements, regardless of what their partner thinks or feels, experience meaningfully higher rates of performance anxiety, sexual avoidance, and relationship disconnection. The perception shapes the experience. The experience reinforces the perception, and the cycle compounds quietly over years. The reverse, and this is the finding that I want you to sit with, is equally powerful. Men who experience genuine physical improvement, even modest improvement, even partial recovery of what was lost, report psychological returns that are disproportionately large relative to the physical change. A small, measurable improvement in erectile quality or functional size produces an outsized shift in confidence, in sexual assertiveness, in the willingness to be present and engaged during intimacy rather than anxious and avoidant. The brain, it turns out, responds to evidence. When the body begins to deliver different results, when a man can feel and observe that things are changing, that what he thought was permanent is proving to be movable, the psychological architecture around his sexuality begins to shift. Old stories loosen their grip. New possibilities become available. This is what I watched happen to David. It did not happen all at once. It was, like everything about this process, gradual, a recalibration rather than a revolution. But it was unmistakable, and it was cumulative. Each week that he stayed consistent, each small confirmation that his effort was producing real results added another layer to a confidence that had been quietly eroding for years. By month 4, he was a different man in the bedroom. Not because everything was perfect, it never is, but because he had stopped apologizing for himself, stopped bracing for disappointment, stopped being in his own way. He was present, confident, engaged, and that, more than any measurement, more than any physical change, is what transformed our intimacy. I have seen this pattern in my clinical practice more times than I can count. Men who come in deflated, avoidant, and quietly ashamed, and who, through understanding and consistent effort, rediscover a version of themselves in the bedroom that they had genuinely believed was gone forever. It is not gone. For the vast majority of men, it is recoverable, and the path to recovering it begins, as almost all meaningful change does, with information. 18 months ago, my husband David quietly started something he didn't fully know how to explain to me. He had found in the research and clinical literature something that most men his age never find. Not a miracle, not a shortcut, but a genuine, grounded, evidence-based understanding of what had been happening to his body and what he could do about it. He understood the hidden inches phenomenon. He knew that some of what he had experienced as loss was anatomically recoverable, that suprapubic fat reduction and vascular restoration could reveal and restore length that had always been there. He understood the pelvic floor connection. He knew that the muscles at the base of the penis, muscles he had never once been told existed, were directly responsible for the firmness and fullness of his erections, and that they could be trained, strengthened, and restored. He understood the testosterone dimension, not just as a libido issue, but as a tissue health issue. He knew that the smooth muscle of the penis responds to testosterone, and that optimizing his levels through sleep, resistance training, and nutrition would support the structural restoration of erectile tissue quality. He understood penile rehabilitation. He knew that consistent daily tissue maintenance through a structured protocol was not a performance tool, but a long-term health practice that would protect everything he was working to restore. And he understood, perhaps most importantly, that the confidence he was chasing was not the destination. It was the natural consequence of a body that was being genuinely, consistently, respectfully cared for. 3 months into his journey, I noticed. 6 months in, he told me everything. And what he described, the research, the protocol, the quiet, daily commitment, was not what I expected. Because I had expected something dramatic, something complicated, something that required extraordinary effort or resources. What he described was simple, consistent, grounded in science, and entirely available to any man who is willing to understand what is actually happening in his body and to do something about it. If this video gave you something today, a new understanding, a moment of recognition, a first piece of information that you have been looking for without knowing exactly where to look, please share it. Share it with your partner. Share it with a friend. Share it with the man in your life who you know is quietly carrying this, who has never had the language for it, or the permission to talk about it, or the information to do anything about it. Leave me a comment below. Tell me where you are in this journey. Tell me what question you most want answered next. I read every single comment on this channel, and this community is built one honest conversation at a time. If you are not yet subscribed, please do that right now, because what I share here every single week is exactly this: real information, clinical honesty, and the conversations that men over 60 deserve to be having, but almost never get get to have. I'm Dr. Julia Rhodes. I'll see you in the next one.